Going? Is it gone yet? That's the question from the Absorb trial. They're using MSCT for assessing the performance of a bioresorbable stent. And I am with, in this JACC paper, the author, Dr. Koen Nieman, MD, PhD. Now, let's talk about this paper from JACC. What is it that you're looking for? You want to find out just what's happening to this thing, right?
Right. So what we have here is a new kind of scaffold that dissolves over time, that doesn't leave any trace, and could potentially restore the normal form and shape and reactivity of the vessel. Now, up until now, usually when there are new devices that are being tested in humans, it required invasive procedures to follow up on these patients. And what we did with this study for the first time is use the CT scan as an alternative to invasive angiography to follow up on these patients and see whether the scaffolded area, the treated area, actually stayed open over time.
And what are you finding? How long does it take for it to get out of there?
Well, we tested this group of patients after 18 months, and what we saw was in the majority of patients we did not see any restenosis. There was one case where we thought there was a restenosis on angiography. The other cases, they were all still open. There were a couple of cases where we doubted, where there was like a 50% stenosis within a treated vessel, and what we did in those cases, we tried a very new technique, which is called CT-FFR, to evaluate whether the lesion, the stenosis that we angiographically see, whether that is actually functionally relevant. And we tested that as well, and those patients that we could test that turned out to be negative as well. So we basically, in the end, we had, except for one patient, we had no stenotic and no hemodynamically significant stenosis of the treated vessel.
Are you seeing some differences, some remodeling effects?
Not really. There were incidental cases. There were two cases where there was one case in this cohort that after the procedure there was a slight dilatation of part of the vessel, and we don't know whether that has to do with the device or that was just incidental, but we did see that in one occasion.
So it really does disappear and it does not have much effect on the surrounding tissue.
That is the interesting thing, that it completely disappears. There is no reaction after it has been dissolved. The vessel is basically the way it was before, and therefore that has potential positive effect on the patient to have this foreign device basically removed from your body after its work has been done.
Now that you know a little bit more about the whole procedure and about from the Absorb trial, what's the future? Where is this going?
That's very interesting. I mean, I think we still need more trials because this population that we studied was quite a simple population with single vessel disease, single lesions. We only had a single size device that we could use, and what we'll see now is we'll start using this in more complex lesions, in more diffuse disease, multi-vessel disease. We will be getting different sizes of scaffolds that we'll be using, and then we have to see whether this positive results that we found initially still holds on in those populations as well. Now,
are you going to continue? You've got about 18 months of data from looking at these people. Are you going to do anything more beyond this?
Yes, there are more trials. We have also a population that was the earliest population where we actually have 5 years results, and hopefully they will be published in the near future as well. And as I said, we'll be starting larger populations, different size of scaffolds, and we'll also be following up those patients as well using invasive techniques, but also the non-invasive techniques.
Well, the data is in JACC, and you'll see the citation in just a moment. The Absorb trial has been just absolutely fascinating, and more data from it. From CardioSource World News, I'm Executive Editor Rick McGuire.